Welcome back to another edition of the Hart2Heart Podcast. And today I'm going to be talking about immunity, how to get over a cold, how to treat a sore throat. Welcome back to another edition of the Hart2Heart Podcast. And today I'm going to be talking about immunity, how to get over a cold, how to treat a sore throat, how to treat a cough, just a lot of the basic stuff that a lot of people want to know going into the flu season, going into the winter. So I've broken things down into several different categories. So where I want to start is just with general immunity. You know, like what can you do to optimize your immune system to make sure that you don't catch a cold in the first place, or that if you do catch a cold, you're not going to be affected as severely as if you were not optimized with your immune system. So how can you optimize your immune system? So I know you guys have heard me talk about this before, but I got to say it and get it out of the way. Obviously, vitamin D. Okay, everyone knows this. There's been, Cochrane reviews that have shown that it's been effective for various different upper respiratory tract infections. It's even been shown to reduce the severity of COVID, which I don't think is, controversial to say anymore. And again, I'm not saying that if you take, a super physiological amount of vitamin D, if you take, exuberance amount of it, that you're going to have super immunity. All I'm just saying is if you are deficient or insufficient in vitamin D, you're probably going to have a worse time with COVID, and you're probably going to have a worse time with any upper respiratory tract infection. And obviously vitamin D has other properties as well, like low vitamin D is linked to depression, it's linked to low testosterone, it's linked to osteoporosis. So, you shouldn't be taking vitamin D just for immunity. You should be taking vitamin D for other reasons as well. So, that's one of the absolute basics. So people always ask, how much vitamin D should you be taking? I usually recommend people to get themselves tested. When you get yourself tested, then for sure, if you are taking the correct amount. But, usually around 500 IUs to 1,000 IUs per body weight is a decent dose. I would start off with 5,000 IUs per body weight and then go from there. Get yourself tested. If you're still low, then you can increase it. If you're taking a little bit too much, and obviously you want to decrease it. And vitamin D is a fat soluble vitamin, unlike vitamins B and C. So, there is some risk for toxicity if you do use too much. Kidney stones would probably be the biggest one, or the most common issue with taking too much vitamin D. And as we know, kidney stones are not fun. What else can you do to enhance your general immunity? You want to be sleeping 7 to 8 hours a night. If you don't sleep very well, your immune system does drop. And unfortunately, that's going to lead you to have a very worse time. If you do catch a cold, you catch some type of upper respiratory tract infection. So make sure you're sleeping 7 to 8 hours a night. I won't go too much into detail into, how you do want to get a good night's sleep, but I will say for sure, okay, try to get some sunlight in the morning and try to use some blue blockers at night before bed. I think light really affects people's sleep. Make sure that your room temperature is fairly cold. Okay, a lot of people are surprised to hear that most people sleep optimally between about 60 to 68 degrees Fahrenheit. Now, if this is not you and you really need to warm up, that's different. But again, a lot of people do find that using a temperature between about 60 to 68 produces the most optimal sleep for them. So again, sleep is a big topic. I'm not going to go into it too much, but it's critically important to optimize your overall immunity. Third on the list, I have avoiding ultra-processed foods. So if you do eat ultra-processed foods, they can weaken your immune system. So you do want to avoid eating ultra-processed foods. And again, just like a lot of the other things on the list, like the vitamin D and sleep, like you want to be doing that anyway. Like just like you want to be taking vitamin D anyway, just like you want to be sleeping 7 to 8 hours a night, you also too want to be avoiding ultra processed foods for the most part, because they're not associated with good health. I know there was that review recently that came out maybe 2 or 3 months ago, I'm not sure how long ago, by the USDA said that 91% of your food intake can be ultra processed. I think that's a garbage statement for them to be putting out. Definitely avoid ultra processed food. Eat whole foods. That will help with your overall general immunity. Another thing in the nutrition category you can do to optimize your immunity is to not get your blood sugar too high. So hyperglycemia, high blood sugar, that is linked to poor immunity. That's part of the reason why diabetics, for instance, don't heal as well and why they do get more infections. Okay, so hyperglycemia, having high blood sugar, is something that can lead to a weakened immune system. So you definitely want to control your blood sugar. Okay, you don't want to have too many carbohydrates at one time, especially not too many high glycemic carbohydrates at one time. That's what's really going to spike your blood sugar. So again, things that you should be doing anyway, right? You should be avoiding high blood sugar for reasons, unrelated to your immune system anyway, just to have good metabolic health. Next on the list, I have zinc. So zinc is something that, again, if you're taking copious amounts of it, it doesn't necessarily mean that you're going to have super immunity. But if you are deficient in zinc or you're insufficient in zinc and you catch a cold, again, you're probably going to have a worse time. So make sure that your diet is loaded with zinc. If you are someone who's going to supplement with zinc, I've talked about this before, it's fine to do that, but just be careful with it, because if you have too much zinc, it does create a copper imbalance. So, when I supplement with zinc, I use something that has copper in it. So that way I know that even though I'm supplementing with zinc, I'm not going to be throwing off my copper balance. So something to keep in mind to make sure that your levels are optimized and that your immunity is optimized. Another thing that you should be doing, again, not just for your immunity, but in general, is just exercise. So people who exercise have better lung capacity. They do better generally overall when they catch a cold or when they get an upper respiratory tract infection. So it's absolutely true that you should be exercising every day anyways, or at least 5 to 6 days a week for, obviously various different reasons: mental health, physical health, better sleep, lower rates of cardiovascular disease, lower rates of mortality. There's so many reasons why you should be exercising. So obviously I can't go into all that, but if you are exercising, that is going to keep your immune system optimized. Next on the list, I have vitamin C. Again, kind of like the other vitamins, taking copious amounts of vitamin C, not really shown to reduce the severity of infections. I mean, there's some evidence if you have super high doses of IV vitamin C, it will. But even then, it's mostly just kind of reducing the severity of the symptoms, maybe a little bit over a few days, but not dramatically. So again, this is not something that you need to be over supplementing with. But if you are in fact sick, taking a little bit of extra vitamin D or vitamin C, whether it's 500 milligrams or if you want to take a gram a day, I think that's fine. But I don't think that you need to go overboard. I don't think you're going to get too much of an advantage by using a copious amount of vitamin C or a high amount. But if you are insufficient or deficient, obviously, low amounts of vitamin C can lead to weakened immunity. The last thing that I have on the list is something called quercetin. So quercetin is probably something on the list that maybe people have or have not heard of. But one of its actions is that it's a zinc ionophore, and then it does seem to have even some antiviral properties on its own. So some people have found that by using quercetin when they're sick, they do find that their immunity does become a little bit more optimized, and they find that their symptoms get cleared up quicker. Again, I'm not saying that quercetin is a magic pill at all, and I'm not saying that you even necessarily need it. I'm just trying to go over all the things that I found that are associated with optimized immunity. So that mostly covers the things that you can do for your general health or for your general immunity to make sure that when you do catch a cold, you're not going to be, really taken down with it, and that you're giving your body the best chance to fight. So again, just kind of go over the list. Make sure that your vitamin D is optimized. Make sure you're sleeping about 7 to 8 hours a night. Avoid ultra-processed foods. Avoid high glycemic carbohydrates that are going to create a big spike in your blood sugar or hyperglycemia. Make sure that you're exercising regularly. Get adequate amounts of zinc. Get adequate amounts of vitamin C. And if you wish to do so, you can, in fact, add some quercetin when you're feeling a little bit unwell, or even prophylactically. That may help. Again, I'm not saying that it's a magic pill, and it definitely will, but it's something that a lot of people have reported, mostly anecdotally at this point, though, unfortunately. So why don't we move on to one of the maybe more irritating symptoms, something that I see, all the time in my practice is sore throat. So, I work walk-in shifts, I see lots of people who are sick all the time. I see lots and lots of sore throats. Now, what I'm going to say is that I'm going to go over things that are treating the symptoms of a sore throat. Now, if you go to your doctor and you have pus in the back of your throat, you have strep throat, you need an antibiotic. Okay, so the things that I'm going to talk about, they can definitely treat the symptoms associated with the sore throat. But if you have a bacterial infection, like if you have strep throat, then you absolutely need an antibiotic. Okay, so penicillin or amoxicillin, those are the ones that we usually use for treating strep throat. And again, if you do have pus, if you're really in a lot of pain, you really can't swallow, go to the doctor. Make sure that you don't have a bacterial infection. That being said, what can you do if you do have a sore throat and you're at home? And I also should say too that just because, you have a viral infection versus a bacterial infection, so just because you don't have pus in your throat doesn't mean that you can't have an excruciating sore throat. So again, like your throat doesn't, care whether it's bacterial or viral, it's still going to be in pain. And so, we need some ways to treat that pain. I'll go over that with you today. So the first one on the list, I'm sure you've heard this before. This is the most basic one, but Advil or Tylenol, they can provide a little bit of symptomatic relief. If you have a really sore throat, again, if you have something that requires a bacterial infection, they may not, dramatically reduce the pain, but for some people, they may take away 25 to 50% of the pain, at least for a few hours. If you do have high blood pressure, be very careful about using Advil. There is some evidence that can increase your pressure. And then with the Tylenol, of course, if you have any liver issues, be careful with that. And then one thing that you do want to be careful with those medicines too is something called rebound headache. So, only use the medicines when you need to. If you use them too often, then unfortunately, when you stop, you can actually get something called a rebound headache, which you want to avoid. So only use them when you absolutely have to. Next on the list is something called B Propolis spray. So it's a spray that you can use. A lot of people have found this to be very effective. A lot of my patients have said that it's been very effective anecdotally, but I've also found some studies online that have said that have shown that it can be effective for helping alleviate the symptoms of a sore throat. So that's a B Propolis spray. Propolis spray. It's something you can get over the counter. Again, a lot of people find it to be really effective, especially if you get it right at the onset of your symptoms. It can definitely provide some symptomatic relief. And again, it's all natural, and you can use this in combination with your antibiotics if you are in fact on antibiotics. The other thing you can use for a sore throat is something called betadine mouthwash. So it comes in a blue bottle. That's how I've seen it anyway. You can also get it in a nasal spray as well. And then I think a throat spray. A lot of my patients, again, this is anecdotal, but they found that by using the mouthwash, they've gotten really good results. And I can tell you that when I had COVID, the one and only time that I did have COVID, it was fantastic for my sore throat. I found that it really gave me some symptomatic relief, even if it was just for a few hours. But again, when you have a sore throat, you want to kind of do anything you can to reduce it. And then last on the list as well, I find for whatever reason, there's something that is sometimes goes miss, but it can be really effective, even if it's just for, a half hour to an hour or 2 hours, but just plain old cough drops, some strong cough drops, it's, Fisherman's Friends or, the Hall's Extra Strength, whatever it is, they can provide some relief for a short period of time. Just be careful about, purchasing ones that have, a ton of sugar, because again, we want to avoid, hyperglycemia. That being said, there's going to be so little sugar in these that it shouldn't affect you too much if you do decide to get ones that, do have a little sugar in them. And then the other part of that too is that when you're sick, your body temperature and your metabolism tends to go up a bit. So, you probably will be burning more calories anyway. So, if you do need to use a few cough drops to help with your sore throat, that's definitely something that I would recommend, and that can provide quite a bit of relief. So again, just to recap, if you do have a sore throat, I usually call this my ABBC method. So A is for Advil or for Tylenol, and you have B for Propolis and for betadine mouthwash, and then you have C for cough drops. So again, those 4 things can really help treat a sore throat. But like I said at the beginning, if you do have strep, you need an antibiotic, you need to go see a doctor, and you need that script. So let's move on to another symptom. So another symptom that a lot of people struggle with when they get an upper respiratory tract infection is a cough. So I do have a couple things that I can tell you about over-the-counter wise that you can use for a cough. And then, of course, there's a couple prescription medicines that I'm going to talk to you about as well. Now, when you do have a cough, that can be pretty serious if you have, chronic obstructive pulmonary disease. If you have a COPD exacerbation, you're a smoker, that's something that, sure, some of these things can still help, but you really need to go to a doctor. Then you're probably going to need an antibiotic. You may need prednisone for a few days, and then you may even need a steroid inhaler in addition to something called Ventolin. Now, Ventolin or salbutamol, that's something that I also use for people who have viral illnesses or viral coughs. So that's perfectly fine to use there. But again, if you have a severe bacterial infection, if you have fever, if you have real big thick phlegm, say green and yellow phlegm, that's really more indicative of a bacterial infection. And in that case, you will need an antibiotic. Again, if you're someone who has COPD, chronic obstructive pulmonary disease, you're going through an exacerbation, that can be pretty serious, and you definitely want to get into your doctor as soon as you can and make sure that you get treated. So, there are some serious things to discuss before we, get into some of the things that can help. And obviously, if you're someone who's had pneumonia before, these kinds of things, you want to get in to your doctor, make sure that you get a chest x-ray, make sure that you get assessed. Okay. Now, if you're just someone who's kind of having, the run-of-the-mill bronchitis, you got a little bit of cough, you've been assessed by your doctor, they've even given you an antibiotic, maybe they didn't give you an antibiotic, what can you do to help get rid of that cough? Well, there are a few different things that you can do. One of these I've actually just learned about very, very recently, so please forgive me if I'm saying this right. I'm definitely going to spell it out for you, but it's called Umckaloabo. So Umckaloabo. So if you go on examine.com, which is an unreal website, and you type in bronchitis or symptoms of bronchitis, I forget which one, the only thing that they actually give grade A evidence for is this particular compound. And when I've gone online and looked at some of the evidence, there does seem to be some pretty strong evidence that it is effective for treating some symptoms of chronic bronchitis, of that cough that people get. So, I do think that is something that is reasonable to try if you are having a cough and you can't get rid of it. What are some other things that you could possibly use to help get rid of a cough? So B Propolis cough syrup. This is something also that's just came up on my radar. There's a little bit of evidence for that. There's not a ton of evidence, I would say, but I have seen some anecdotal evidence in addition to the limited evidence online. If you do a PubMed search though on B Propolis cough syrup, you will get some positive studies there. You can see them for yourself. So I do think that because of that, it's a reasonable thing to try if you do have a cough. Next on the list, I have probably the thing that's, I would say, is most commonly used over the counter for a cough. So dextromorphan. This is the thing that's probably most commonly used in most antihistamines or most anti-cough medicines or syrups. Surprisingly, the evidence on this is a little bit mixed. I did see some studies that show that using dextromorphan can reduce the cough. And then I saw some studies indicating that it had, limited effect overall. So, I think, again, it's something that's like reasonable to try, but I wouldn't say that there's, real hard, great evidence on dextromorphan really reducing people's coughs overall. But again, it's one of the only over-the-counter medicines that we have that has at least some evidence, and some people do find it to be effective. So, I wouldn't kind of, get rid of it from the toolbox yet for sure. A couple more things on cough as well. One thing in particular is, I mentioned it before, and this is a prescription medication, but it's Ventolin or salbutamol, which is a beta-2 agonist. So basically, it's a bronchodilator. It bronchodilates your airways. And a lot of people find it to be helpful for symptoms of shortness of breath and also for cough. So, something that you can use whether you have a viral infection or whether you have a bacterial infection. So when I have patients come into my office and they don't have fever, they don't have thick green phlegm, but they still have that irritating cough that's likely viral, I will prescribe them Ventolin or salbutamol, and it does usually give them quite a bit of relief. So there is some hope for that. What's another symptom? What's another symptom that people are struggling with sometimes when they get a upper respiratory tract infection? We've talked about cough, we've talked about sore throat, but we haven't talked about nasal congestion. So a lot of people do get nasal congestion, particularly in the winter time, and it can be very, very frustrating. Obviously, having a runny nose all day, it can also just be a little bit embarrassing, and you don't want to be wiping your nose when you're with patients, when you're doing your job and that kind of thing. So in terms of nasal, something that helps with nasal congestion, usually use a nasal decongestant. So there's a few that are out there. So there's pseudoephedrine is one. There's, and again, forgive me for my pronunciation of these. Then there's phenylphrine is another one. And then there's another one, oxymetazoline. And so out of those three, it seems like the pseudoephedrine is the one that's best. That's usually in products that I believe have Sudafed. There are, however, products that have that are Sudafed products that have the phenylephrine. And like I said, the product that has the pseudoephedrine is the one that's been shown to be most effective for nasal decongestions. Now, the problem with that, though, is that you don't want to take these products for today. So what I'm talking about is you can either get them as a tablet, or they're the nasal ones you can just squirt up your nose. Those are the products that I'm talking about. Again, they can work really well, but the one that seems to be best is the pseudoephedrine one. Usually it's marketed as Sudafed in some type of capacity. But like I said, the Sudafed also has a phenylphrine. So really look on the ingredients for those and make sure you get the pseudoephedrine one. That's the one that seems to be the most effective. These, again, though, similar to treating a headache like with Tylenol or Advil, but to a much more degree, they can also cause rebound decongestion. So, or rebound congestion rather. So, meaning that if you use this product, for too long, too much, you can actually cause a rebound and get even more congestion. So you don't want to use it for too long. How long is too long? Sometimes even 3 days. So just be careful about using it more than 3 to 5 days. Be really careful, because you don't want to get, some type of rebound congestion. Another thing that can help with nasal congestion, particularly with allergic rhinitis, but sometimes nasal congestion in general, can be spirulina. So this is something that may be surprising to some people. So spirulina is a product. It's a supplement you can get. It's a very, very green, very, very messy substance. Has a lot of good properties. Really high in protein, but also has some antiviral properties. It's actually been shown to help reduce liver fat as well in a few different studies. But it's been shown to be very effective for allergic rhinitis. It may help with your congestion. So all things that can help. Now, I will say that this kind of mixes into another symptom, headache. But when you have a really, really strong nasal congestion where it's like really green just coming out of you and you can't really stop it. And you have this pressure headache and pressure here around your temples. That's indicative of a bacterial sinusitis infection. And that is really something that you don't want to mess around with and something that you will need antibiotics for. Again, the products that I just talked about, they can help treat your symptoms, but it's not going to be the same as if you get a strong antibiotic. And in this case, when people have, an acute bacterial sinusitis, we usually use Umckaloabo. So, that's a pretty heavy antibiotic for about 5 to 7 days for most people. And that seems to work. So again, if you are experiencing, really severe symptoms of headache, congestion, this like purulent green yellow discharge, then you definitely want to make sure that you go see your doctor and get assessed, because you may in fact have an acute bacterial sinusitis infection, and getting some Umckaloabo, can be very, very helpful in that particular case. Now, sometimes, mucus production and nasal decongestion, they can be grouped together a little bit, but obviously you can get, cough up mucus from your lungs as well. So they are a little bit different. So I do want to go over mucus production and how you can potentially reduce that. So there's a couple different things that you can use. One of them is called Quercetin, often marketed as Mucinex. So this is something that's an expectorant. So it'll break up that mucus. So when you can't get that mucus up, when you can't get that out, something like Quercetin can help break up that particular mucus. Another thing that you can use if you're struggling with mucus production is something called serrapeptase. This is not something that I've had a lot of patients had any experience with, unfortunately. It's something I think that's fairly new. The Quercetin, the Mucinex, I've had lots of patients use that and have lots of success with it. And there are lots of studies online indicating that it can, in fact, be effective for mucus, for reducing not as much for mucus production, but lowering, as an expectorant, so it'll break up the mucus. The serrapeptase seems to be more for clearing the mucus, and the same too with something called NAC, N-acetylcysteine. So you may have heard of NAC for various different things, and it was threatened to actually even come off the market earlier this year, but luckily I don't think that occurred. Now, one question I get with NAC, because it has been shown to reduce mucus production when people have chronic obstructive pulmonary disease. So it does do that. But, some people think that, if I use this all the time, like maybe I won't develop chronic obstructive pulmonary disease. It hasn't been shown to do that from what I've seen, but it does seem to help with the symptoms of chronic obstructive pulmonary disease. So even if you're not sick, like even if you're not, actively have an upper respiratory tract infection, but you have COPD and you need to break up that mucus, it is something that has been shown to reduce the symptoms. And again, most of the evidence is on more COPD long term, but some people have reported that over in the short term, they can use a little bit of NAC, and that does seem to help, reduce their mucus production, reduce their symptoms of bronchitis. So I only have one more symptom that I'm going to be going over with you guys, and then I will probably do a little bit of a recap at the end, and then we'll go from there. So the last symptom that I want to go over that sometimes people get with an upper respiratory tract infection is ear pain. And ear pain can be, quite debilitating. And again, if you do have severe ear pain, again, you need to get assessed by a doctor. If you've been swimming recently and you have, swimmer's ear or otitis externa, we'll call it, on the outer ear, that can be really painful. Even just pulling on like the tragus hair, pulling on your ear in general can actually be super painful. If you have otitis media, or when you have an infection in your middle ear, again, you need to get assessed by a doctor. You need someone to look inside your ear and see if there's any pus in your canal, see if your tympanic membrane's red and angry, or if it's bulging, and make sure that you do get treated if in fact you do have those symptoms. And if you do have otitis media, otitis externa, obviously you will need an antibiotic. I like to cover people with both. So meaning I like to give them an oral antibiotic, and I also like to give them a local antibiotic or an ear drop. Unfortunately, in Ontario anyway, most people are able to get the amoxicillin or the oral antibiotic because that's covered. Ciprodex, unfortunately, which is a combination of ciprofloxacin and dexamethasone, so it does have an anti-inflammatory component in it. That unfortunately is not covered by a lot of drug plans. I wish it was, but for the most part, if you have a really severe infection, the amoxicillin should be fine. But if you can get both, I generally recommend to my patients to get both. So say if you have ear pain, you've been assessed by a doc, but you don't need an antibiotic, but you still have these really crazy bad ear pain. What can you do to help? You can get some. They're called polysporin plus pain relief ear drops. So the active ingredient in it is polymyxin B sulfate, but the other thing that has in it is lidocaine. So lidocaine is a topical anesthetic, so it can give just some local relief and just some local pain relief if you are having a sore ear or a painful ear. And again, the polymyxin B sulfate may provide a little bit of antimicrobial action as well. So, but just be careful, because I know that there is another polysporin product out there that doesn't have the lidocaine in it. So make sure you get the polysporin plus pain relief ear drops if you want to get the lidocaine to treat your ear pain. And then of course, the Advil and Tylenol again can help with pain in the ear if you are in fact having ear pain. So again, don't really have too much else to really go over here. I do have, headache, but, obviously using Tylenol or Advil can be helpful for that. If you're having a headache as part of, the constellation of symptoms that you're experiencing. I've mentioned before, for a stress headache, peppermint oil, topical peppermint oil. Actually, I think I have some right here. Ironically, or no, I don't, but it comes in as something kind of like this, and you literally just rub it on your forehead like that, and even on the back of the neck. I mean, that's been shown to be helpful for stress-induced headaches. So I can't say for sure that it's definitely going to be helpful for a sinusitis type of headache, but I think it's reasonable to try, considering that it was shown to be as effective as 2 extra strength Tylenol in a study that was done, I think around 2006, something like that. So that's kind of what I have for you today, guys, in terms of getting rid of optimizing your immunity and getting rid of some of those nasty symptoms. So again, general immunity, guys. Vitamin D, okay, 5,000 to 1,000 IUs per body weight. Make sure you get yourself tested. You don't want to be taking too much and cause kidney stones, anything like that. Sleeping 7 to 8 hours a night, you should be doing that anyway. Avoiding ultra-processed foods, you should be doing. Avoiding high glycemic carbohydrates. Exercise and get adequate vitamin C, getting adequate zinc, and you can add some Quercetin there if you want. If you have a sore throat, again, ABBC method, Advil or Tylenol can help. The B Propolis spray, betadine mouthwash, and cough drops. If you have a cough, again, this very strange compound that I can't really pronounce too well, but Umckaloabo, I think it's called. B Propolis cough syrup can be good for a cough, in addition to potentially dextromorphan. And if you do if you're lucky enough to get a doctor to give you some Ventolin, that can help as well. Nasal congestion, again, looking for the product with the pseudoephedrine. That's one that seems to be the best. Some spirulina may also be helpful. Mucus production, guaifesin or Mucinex is helpful, but also potentially some seropeptase and some NAC or N-acetylcysteine. If you got any ear pain, the Advil or Tylenol can be helpful, and then also some over-the-counter ear drops. The polysporin plus pain relief ear drops would be best. But of course, like I've been saying all podcasts, when you are sick, go to a doctor, get assessed. Make sure you don't need an antibiotic. Make sure it's something not more serious. Make sure you may even need a chest X-ray. You may need an X-ray to look at your sinuses. So all reasons to make sure that you go to a doctor and get assessed properly by a professional. So guys, thank you so much for watching this. I hope that it was helpful for you guys. Please leave any questions and comments in the comment section, and I'll try to get back to all of them as soon as I can. And as always, thank you so much for watching, and I'll be back again next week.